So the day before your internship, please reach out to us. That way you know the start time. We usually start at 8 a.m. with our appointments. Most interns arrive 15 minutes early. That way we can show you around the practice and just let you know what the caseload is for the day and to round on our patients. But do email us in case our start time changes. Let's see, when you arrive at the practice, you'll just enter through the front door and I'll take you back to where you would store your belongings. So you just come all the way to the back and you would place your belongings back here in the back cabinet. So right here, any jackets or purses you can also hang up over here by our washer and dryer. Food can be stored in here, so your lunch can be stored right here. And then you can just meet with the doctor or the team up front to go ahead and get started. So I'll give you a tour of the practice. This is our back area. This is where we keep our treats for our patients. So if you ever need extra food, this is where you can grab treats. Back here, just chemicals and cleaning supplies. Here's where we keep a lot of our orthotics and prosthetics. So if we're doing adjustments on our patients, this is where you can go ahead and grab some of those belongings. The bathroom, if you need to use the restroom, is right here. We have fresh water. For our patients, we often use licky mats to smear peanut butter on and spatulas for the patients to lick peanut butter. So when washing them off, we just wipe the excess peanut butter and use the scrub to wash it off in the bathroom sink. So right in there, and then we just let things air dry on this table. Washer dryer is right here. And between patients, we're constantly washing towels. So if you see a pile of laundry loading up, go ahead and get them started in the washer and dryer. Cleaning supplies for the washer and dryer right there, and our vacuums right there too. So we do vacuum our rooms in between patients, and we vacuum the big exercise area when hair builds up. I'll take you to the underwater treadmill. So this is our underwater treadmill. To operate the underwater treadmill, when a patient goes on the underwater treadmill, we always put on a vest based on their size, and then we use treats to lure them into the treadmill. When you have a patient in the treadmill, always make sure you check both your doors and you lock the top and the bottom of the treadmill, and then you go and check the back door. Often one person is treating the patient while the other person is operating the equipment. So treats are over here. We have the container of dog treats and we have the peanut butter. We don't smear peanut butter on the front of our window. So instead we utilize peanut butter on a spatula, or we utilize licky mats attached to the front of the window for the patient to lick the peanut butter. Everything is manual on the screen. So first we fill the underwater treadmill, so you hit the fill button. The water will fill up. You hit the fill button again to stop it. And then always pay attention to your forward and reverse. So when this is lit up on forward, when you hit forward, the dog would be walking this way. When you hit reverse, it's if you want the dog to walk this way. So before anyone ever starts the treadmill, we always check to make sure we have the treadmill going in the right direction. So say we're gonna walk the dog in reverse, we're gonna hit the start button, and then we're gonna slowly increase our speed to our desired speed. Most patients are around 0.4 or 0.5. When stopping a patient, always make sure that you slow the speed down first. So you hit decrease, decrease, and then you hit stop. So you don't just stop it abruptly because you don't want them hitting the front of the glass. And to drain the underwater treadmill, you just hit drain again. When the treadmill is done draining, you'll hear a loud gurgling noise when it's just sucking up air, and then you hit the drain button again to stop it. We have waiters over here. So a lot of our neurologic patients, you may be getting in the underwater treadmill with them to help them gait pattern or to spinal walk them. And then we have some floaties and assistive devices if need be. After the patient comes out of the underwater treadmill, it's very important that we always always wipe down the underwater treadmill between each patient. We work as a team to coordinate that. So if the doctor's drying off the dog or the assistant's drying off the dog, go ahead and grab some cleaning supplies to clean down the treadmill. We have this spray bottle, which is vinegar and water, and we have a microfiber cloth down here that we utilize. So we spray the edges of the underwater treadmill, specifically where there's a grime layer, so you'll see a line of grime that builds up when the patient's in there. And then the other thing that we spray and wipe down is the outside of the doors. So along these edges right here, we'll go ahead and spray and wipe down. So between each patient, when your patient comes out, make sure you wipe down the underwater treadmill. These are different exercise equipment. So go over what we call them, because every practice names their exercise equipment differently. These are what we call KO steps. This we call the rocker board. This we call the aerobic step, proprioceptive mat. We call these fit pads. This is a BOSU. Fit bones, the fit disc. Let's see, we call this the wedge. Oh, and we call these infinity discs, cavalettis. So we pull out the equipment, we'll set up our obstacle course for our patients, and then after each patient, make sure that you put the equipment back, just so that the next doctor can come in and set up their equipment. This is our land treadmill. To operate the land treadmill, if this light's on, then the entire treadmill's on. You hit the red button. So this is our start stop. You hit it again, it's going to count down, and then it's going to start. And this is how you increase your speed. Again, just like the underwater treadmill, make sure you decrease your speed all the way down before you hit stop. That way they're not stopping abruptly. And then you just turn off the side of the land treadmill. Perfect. Over here, this is our waiting area. So when clients arrive, please greet them and greet their dog and bring them back to the waiting area if the room is full. Do introduce yourself to the clients, let them know that you're an intern, and ask them if it's okay if you join the appointment. Most of our clients are fine with interns being an appointment. Every now and then we do get a client that would prefer no interns in, so it's always good to ask them. When addressing our patients, we do have some patients that come in that are aggressive. So you'll see on our scheduling system, we have little symbols that lets us know if the dog is dog aggressive or if the dog is human aggressive. So just be cautious with the patients. I would probably just greet the dog, give them a treat, and just let them be until the appointment starts. When maneuvering dogs through the practice, it's important that you always keep them on leash. So we try not to have dogs off leash. And when leaving rooms, so when we're in the exam room and we're about to leave a room, it's always important that you open the door and look outside first to make sure the coast is clear and there's no dog around or no dog off leash before you let your patient out of the room. This area is just our beverage area, so we have drinks here if you guys need anything. And for your lunches, we have silverware and plates that you could just wash back in the bathroom sink. Treats for patients, and then I'll show you on the computer how you tell if a patient is aggressive or not. So this is our dashboard. You're able to access the dashboard anytime you're here. You can pop on the computer and see what cases we have. If you look, all these dogs are lit up black, so these are all friendly dogs. If it is lit up red, it means the dog has a warning to it. So if we go to the patient record, there's a section right here where it has attitude. So attitude unknown, whether or not the dog's friendly. If it says unfriendly, it means the dog, you need to be cautious with the dog with other patients. If it says caution, you need to be cautious with the dog with humans because the dog's a virus. If you wanted to open the record and see what's going on with the patient, you can right click, hit clinical record, and then there's our medical notes that you can go ahead and read. That way you can find out what cases you're interested in going in the appointments for. And then you also have our lunch breaks, so you know when to take your lunch break. So there's that with the scheduling. You'll pick a couple of cases to do your case studies on, you'll just go ahead and write that on a sticky note and let one of our team members know to email you the record. Okay, so now let's go to the room. So in the room, it's important that we change out the towel, and we get a roll towel too between each patient. So if you're the last one in the room, just go ahead and pick up the towel, throw it in the laundry basket, and lay down a fresh new towel. When we position patients, here's our treat jar. We don't flip patients at our practice. We try to ask them to be participants and maneuver for us. So we'll ask the dog to come to the bed. We'll ask them to go into a sit first, and then so we'll use the treat to bring their head up into a sit, and then we'll take the treat down to the ground to ask them to lie down, and then we'll take the treat to the side to get them to roll over to one side or another. So that's how we position patients on the bed. I'll go over where everything is at in this room. That way you feel comfortable coming in and on your first day of your internship. So there's our treats. Up here is where we keep peanut butter and some of our diagnostic tools, such as our reflex hammer and wipes if need be. This is where we keep our laser glasses. So please do pick a pair of laser glasses. Here's other pairs of laser glasses. But go ahead, pick a pair, wear it for the day, and at the end of the day, do wash your glasses. These are hot stones. So when we perform hot stone massages, always make sure that you're not going to burn a patient. So place it on your skin. If you can hold it for a few seconds, then it's fine to go on a patient. We keep it at 120. When we utilize these, we just put these aside and we do wash them in between each patient and then let them dry in the area back there. That's our hot stones. We have the Paul Wave vibrator. So you just push this button multiple times to increase this frequency of that. And we have pressure wave massagers that we'll utilize on the patients. When you are working, feel free to go ahead and treat the patient to keep them distracted if need be, or if the doctor is talking and the patient is comfortable, feel free to go ahead and give the patient a massage. And here is our acupuncture needles. This is our laser, and this is our ultrasound and electrotherapy unit. So I'm going to go over operating the laser. In order to turn on the laser, you hit this button down here. This is the start stop. And I'll turn on. Some important things about the laser is anytime we're pushing buttons up here, we want to make sure this end is covered. So always make sure it's in here or it's against your hand or directed towards the ground. What I've seen a lot in the past is people will hit start and then the laser is facing the client and it just lasers the client. So just always be aware of your end and make sure that you're not lasering people in the room. To get to the protocols, you hit this arrow. You select your species, which is dog, and then you can select your protocols. So you can hit, for instance, we may do chronic inflammation or acute inflammation. We may do arthrosis. Some of the doctors have pre-programmed settings. Personal, so they have their already pre-programmed settings that you can go ahead and select. Let's go back. So let's say we're gonna do acute inflammation, so post-op TPLO. Always make sure you're on point by point. So if you're lasering a dog and it doesn't ever pause in between, you're probably on scanning. So just pay attention that it's on point by point. You select whether or not the dog is white or black. And then so you select your size. Most often we're doing medium, which is going to be about 12 points of laser. And then you hit start. When operating the laser, to start it, you hit this button, and then when it's done with its dose, it'll go ahead and stop for you to move to the next point. So for instance, if you're doing the knee, we're going to place the laser at the stifle joint line. You're going to run the laser. When it's done, it will automatically stop. If you need to stop it in the middle of a treatment, say the dog moved, just go ahead and hit that button again and it will stop the laser. Once your laser is done, you will then move on to your next point. So most knees, we end up putting the knee in flexion and we just run along the joint line with our points. And then I'll move on to the next point. For hips, we usually go around the greater trochanter, and for elbows, we usually go around radial head, and then sometimes we'll do a straight line on the medial aspect. If you wanted to stop the laser in midpoint, you just hit stop. And then to turn off the laser, you push in, hold down the green button until it beeps, and then you let go. So let's go over the ultrasound unit. To turn it on, there's this button on the back right here, this little switch that you push in. So say we're doing ultrasound, we have different size probe heads. So we have, this is the 5 centimeter probe head. We also have the 2.5 centimeter, and then we have a bigger one that's a 10 centimeter. So you select your appropriate size probe head for the area. Most of the time we're using the 5 centimeter or the 2.5 centimeter if we're at a joint. We may do the 10 centimeter if we're working on a big muscle like the gluteals. On the program, you hit this button right here, which is ultrasound. Then you hit the edit button, and then you select your parameters. Most of the time you keep head warming off. Your frequency, you'll do 1 megahertz if you want to go deep, if you want to go 3 centimeter deep, or you go 3.3 megahertz if you want to go shallow. So for instance, a post-op TPLO, you may be at 3.3. You select your duty cycle. We're usually running 100%. We want to relax muscles. We'll do 50% if we're at a joint line and we want to decrease swelling. So you could run through that. And then your watts per centimeter square, you dial up. We're usually 0.6 for acute. We may go up to 0.8 and 1 for our chronic patients. And then you can set your treatment time. Most of the time we keep it at 7 and we just keep an eye on our time. Rules about the ultrasound: never let this hit air. So if it hits air, it can break our crystal inside. So we always make sure that we have ultrasound gel on the probe and on the patient. If we're ultrasounding the patient and the patient moves, just make sure that you cover the end of your ultrasound until you hit your pause button. So never let that hit air, just always cover it with your hand if the patient moves. When running the ultrasound, we'll put a little bit of gel on. So I'm going to place the unit on the skin, and then I'm going to hit start, and then we're going to run our ultrasound. When you're utilizing the ultrasound, always keep it moving, so never just hold it in one spot. So we're always doing circular motions and moving it. Be careful with the ultrasound if you hit bony areas. So if you're hitting, like if you're on the, let's say you're doing the knee and you hit the tibial tuberosity or you hit the bottom of the femur, that can be a little uncomfortable. So make sure you're staying at your joint line, you're not hitting bone, just because dogs will react with that. The other thing to be aware of is if dogs have really loose skin, you need to stretch their skin and keep it on taut while you're ultrasounding, because the last thing you want to do is it's really just staying on the skin in one spot and then the skin's moving with the ultrasound, and then you're just burning the skin. So always make sure your skin is taut while you're ultrasounding. To stop it, you just hit the stop button, and we wipe off each patient in between. If the patients have long hair, we will wet these towels, and we also have a towel steamer in the other room that you could go ahead and give them a wet towel to go ahead and get all the gel off. Perfect. So this is our home button to get back to that main screen. Now we're going to do electrotherapy. So to set up our electrotherapy, we have these cords. We have channel 1 and channel 2. If you look on the screen, we have channel 1 and channel 2. So just make sure you're on the right channel. It always defaults to channel 1. So you're going to plug in your unit, and then you'll attach your electrotherapy pads. So we got black goes to black, red goes to red. You're going to place ultrasound gel on each pad and then place it on the area of interest. On the screen, you're going to hit clinical protocols, dog, and you're going to select your area that you want to do electrotherapy. So say we're going to do hip. We're often choosing acute pain or chronic pain. So say this is chronic pain, and it already has everything programmed in. So it's going to be continuous, and it's going to run between 1 and 10 hertz. You slowly dial up your intensity. So So most patients were starting at 3, and then we increase from there. This bar right here tells you how good of a contact you're making. So if it's lit up all black, you're making really good contact. Right now it's empty, so it's not making good contact with my skin. And then you hit the start button, and then you run your electrotherapy. When you are done, you hit the stop button. You remove this from the patient. You wipe down the pads, and then you take this to the back and you just rinse it off underneath the sink. Shake it out because you don't want water getting into the hole right here, and then you let it air dry. And then to turn off your unit, hit the back button. We also have the handheld TENS units. So some of the doctors will utilize this, and they can go ahead and show you how to operate that. And I believe they also show you guys how to operate that in the CRI course. I think that is it, everything. So welcome to our internship, and I hope you guys have a good time.